The First Nations Health Ombudsperson is raising alarms about how First Nations patients are being treated in Saskatchewan hospitals. Diane Lafond is that ombudsperson. Her office is currently managing more than 20 serious complaints involving Saskatchewan Health Authority Protective Services. She says those cases point to a pattern of harm and that there should be an immediate, independent inquiry into hospital security practices and one that includes meaningful First Nations involvement. Well, for more, Diane Lafond joins us on the line. Tanse.
Mananto, how are you?
Doing well, Diane. Thanks for your time. Let's just start with what kind of situations are being reported to you right now?
For one, we have had numerous complaints. The ones that we were speaking about today have been very serious, of course, with the late Trevor Dubois incident, as well as numerous others that have come forward. The gentleman, Bryden, out of Prince Albert, and others, Napoleon. There's been quite a few serious incidents with protective services. And we've had no resolution with some of the complaints that we've submitted. So there's been no action of, a way forward and how we can, work to, have better outcomes or some education or no recommendations coming from the oversight body within SHA that we've submitted our complaints to regarding protective services. So we're quite concerned.
Diane, we've discussed a lot about the Trevor Dubois story, which obviously ended in him dying. What's the nature of some of these other complaints? What are kind of some things that people are experiencing in our hospitals?
Over abuse from protective services, which is excessive force, to the point of, harming the individuals. We had one that was, he's in a wheelchair now, from an excessive beating, unnecessary use of force, and the de-escalation. Like, I'm not sure what training from what I've researched, protective services don't receive a lot of training, and are put into these positions of, kind of like authority, right? To manage people coming in and out of emergency rooms. That's where we have most of the issues with. However, there's some within the hospitals. We have a gentleman now that's in a long-term care home due to being hurt by protective services as well. So these harms are very serious to the, speaking to how it impacts their way of life, even their livelihoods, of how they can now, not care for themselves or their families. So, when we've submitted complaints into the management of protective services, we haven't really had any even apologies or, anything that has any substance to it at all.
Dan?
So,
sorry.
That was the reason being for sounding the alarm, is that we need action.
Yeah,
This can't be happening.
Dan, what's the pattern you see here with these incidents?
Excessive force or, treating people with disrespect, systemic change, repeated facilities, where repeated facilities continue to this happens at, University Hospital, St. Paul's Hospital, it's happening there as well, and Victoria Hospital. 3 hotspots for sure. The complaints are coming out of, and it's, it's systemic racism, and I'm going to call it that, right? It's judging and stereotyping people. With you walk in and you're going to visit a loved one in palliative. I had a young man say he was walking in there with his hood on. Security walked up to him and pulled his hood off and said, "You're not welcoming here. You're, basically labeling him a gangster." Right? And he said, "My uncle is dying. I want to go see him." But they kicked him out of the hospital. So it's repeatedly doing these things and stereotyping people, without even knowing who they are or what they're there for, right?
Yeah. Diane, the health minister announced last week that they're doing their own independent review. Are you satisfied with that?
No, I'm not. Because they're doing their own independent review. Where is the engagement? What's the process going to look like? Are they handpicking these people? We want it to be as transparent as possible so that it's done, across the board within all, I speak about the 74 nations. We want engagement from those families that are impacted. We want them to be able to be heard so that, they can recommend changes, right? So that's what we want. We really want engagement, and we want a process that's going to be fair, that's going to have a public report, when we want experts in there that are going to be totally impartial, right? So that we can get a good way forward and have some good recommendations. Our office has some recommendations on protective services. What we'd like to see as well. That comes from patients too, right? So having these voices heard is very important.
Do you think the racism element is even going to be included in its review? Does it feel like they're kind of tippy-toeing around that side of things?
I think they are, and I've said that repeatedly to Saskatchewan Health Authority, and also if you look at Canadian Medical Association, they apologize to Indigenous people in Canada for the mistreatment. But what's the resolutions? What's the solutions? How are you going to repair the damages, right? I haven't seen any solutions or a way forward. There's been no talk of how are you going to remedy this, right? So that's what we haven't heard nothing. We're frustrated. We've got a number of complaints, and what action is going to be taken? It has to come from the people who are impacted. Saskatchewan Health Authority, the province, represent the people, and let's hear from the people's voices, and Indigenous people want to be included.
Dan, what have you heard from people when it comes to the Trevor Dubois case? How has it affected the community, do you think?
I think it's created a lot of fear. I've heard from people that are afraid now to go into the hospital, what's going to happen to them. And what was the policy on this? I was quite concerned when I read the report saying that there was a possibility of a firearm, and then, these other pieces when the investigation was not even completed yet, right? As far as they know, it's still an ongoing investigation. So to paint a picture like that, it really caused a lot of public racism, I would say. Labeling someone that died in the hospital. And I look at it too very similar to when a person dies within, let's say, the correctional center, right? And it's not deemed suspicious. There's an inquest and stuff like that. And I think this one, where he died in the hospital after having a conflict or confrontation with security, right? So, who's investigating that? Is it done internally? Who's the one that oversees the security protective services? What action is being taken? This is very serious, and it deems for serious intervention, right? Because Saskatoon Police is also involved in the investigation now. So we don't have a lot of answers. The family, I spoke to them this morning, and they don't have a lot of answers. They don't even know how their son passed away, what happened. So the grief and loss, how can you grieve when you don't know? There's a lot of different things that play here. And trying to get those answers for the family is important.
Well, and I want to come back to people feeling unsafe to go to the hospital, which I totally understand. Obviously, that's concerning in itself because people might not go for treatable things that could cause them serious harm because of that feeling of being unsafe. You use that example of someone walking in just with their hood on. I mean, it's minus 50 outside. If that person decides not to go back to a hospital, what is your message to people who do feel unsafe to go to hospitals? I'm sure it's not as simple as, well, you got to, you'll be all right. You can go to hospitals. How do you deal with that? How do you help people feel more safe in hospitals?
This is the thing. It's got to come. There's got to be change, right? And there has to be safe measures. There has to be accountability. And, there has to be a guarantee when you go in there, you're not going to come out, or in a body bag. You're not going to be hurt. That's what we expect, and that's what should happen. However, several instances have been that people are mistreated in there, and it's it's going to take a lot of work with a lot of hands on deck and a lot of consultation, with different groups of people. Because yes, I understand that the hospital, there's issues with safety. There's also a lot of things going on within the province and with addictions, mental health, psychosis. Mental health is a huge issue. Where do you go? They're going to the hospitals, right? And I think a lot of that fear is coming from that psychosis piece, right? So when people go there, they're in psychosis, and we have patients that have gone there or their parents have taken them, and there's a lot of fear that comes in because there's mental health challenges, right? So there's a lot of factors that need to be repaired. And how do you do it? The frontline staff there at the hospitals are overwhelmed. There's not enough resources for the number of people. And what concerns me is who's going to get the brunt of it? Who's going to feel it? Racism becomes more apparent when people are overwhelmed, right?
Well, Diane, I really appreciate your time. Thank you so much.
Thank you so much for having me.